So welcome to the coffee hour with Tampa Bay District FEHA. Want to introduce some of our Tampa Bay District board members. So Gary and Latoya, if you guys want to start, just introduce yourselves and tell us what position you are in FEHA Tampa Bay District.
Oh, hi everybody, can you hear me?
Yes.
Okay, all right. Hey everybody, I'm Latoya Backus. I probably know some of you. I've been a FEHA member for like 3-4 years now. So I work for the Department of Health as an environmental supervisor, and I am currently on the chair for the Tampa Bay District. And I know we've been trying to work at everything going on between coronavirus and, all the craziness out there. It's been hard to put together something, so I appreciate Crea and Gary and all the people who've been involved to kind of be able to put this together.
Thanks, Toya. Is Nicole on the phone? Nicole Garvey?
No, Nicole, well, she doesn't work with DOH anymore, so I don't know what she's been up to.
Okay. So that'll be step 2 of our process here next.
Yes.
Greg Crumpton is our secretary for Tampa Bay District, and he's not able to make it this morning. And Joe Zwizzler is our treasurer. Joe, are you on the call? No. All right. So our first order of business is to elect a new vice chair, since we don't have the position is open. Nicole doesn't work for DOH anymore. Is there anybody that would be willing to step up to the position of vice chair for Tampa Bay District? You don't have to raise your hands at once. You can think about it for a little while. We'll circle back around to it at the end of the call. Gary, would you like to start the presentations? And we can start with Gary Frank. How does that sound?
How about letting Mark go first, because he's got a 10 o'clock
hard stop. That's right. All right, Mark, are you ready to present?
Yes, I am.
All right, so I'm going to share my screen. And Mark, you just let me know when you want me to advance the slides. If you can just start off by introducing yourself.
My name is Mark Dubina. I'm the Vice President of Security at the Tampa Port Authority, also known as Port Tampa Bay. I've been in this position about 12 years. And before that, I was a Chief of Investigations for the Florida Department of Law Enforcement in Tampa. I want to say that we've had a great relationship with the Department of Health over the years. Gary's been a good friend to us, both when I was at FDLE and now at the port. We have a lot of issues that kind of cross paths from time to time, and so I think you'll find the presentation today interesting, because there's a lot of health-based issues with the current COVID situation, and we certainly rely on our partners in the health field, certainly the government side of it for sure, for good advice and assistance on all types of issues. So just a quick overview of Port Tampa Bay. As I said, Tampa Port Authority is a government agency. We're a special district under Florida law. We were established in 1945, but we go by Port Tampa Bay as our marketing name. So what I'm showing you is some economic impact information. It was dated in 2015. Some of these numbers are a little higher, but it gives you kind of an overview of the port's economic impact. Most ports in Florida, the larger ports, have a huge economic impact in their communities. So when we talk about the health of the port and the ability of the port to maintain itself during a health crisis, it's very important to understand the impact of that not being able to occur. So you can see on there 85,000 annual jobs, direct or indirect, created by the port. The actual annual economic impacts probably over 18 billion now since this slide was made. And then you can see some of the other information on that slide. Next slide, please. So overview of who we are and what we protect. We're Florida's largest port by land mass. We have about 5,200 acres behind access control gates. That includes our property and some property owned by private tenants that use us for protection. We're the largest port by tonnage. That's basically a function of what we bring in. We export a large amount of fertilizer. We also bring in a lot of aggregate, cement, building materials such as steel and lumber. We're also the energy gateway to Central Florida. If you operate a vehicle or a truck, or you ride on an airplane out of Orlando, that fuel came through the Tampa Port Authority channel. We are the major supplier to fuel for Orlando and Sanford International Airports. There is a separate private facility that provides fuel at Tampa International. As I said, we also are a major fertilizer exporter due to the fact phosphate is widely available in Central Florida and mined here. Shipyards repairs. We're the largest shipyard facility between Mississippi and Virginia in the United States. There are some shipyard facilities that are bigger in the Caribbean, but in Florida, we really are the only one with major shipyard repair facilities. We have 3 major shipyards, and one of those actually also not only repairs ships, but builds them. We're going to talk a lot about cruise, so I'll skip over that. And our container business continues to expand as we add new lines. And you can see on there the pictures depicted. We have a very diverse group of cargoes that come in here. And so in an economic downturn like we're having now, we're actually pretty well positioned by not having to rely on just one commodity like cruise. Next slide, please. So like a lot of first responders, we never stopped working when COVID hit. That was about mid-March. Our non-essential employees, which I really don't like that term, but it's the term we all use, went home. Those were mostly the office workers that were doing things like finance and procurement and marketing. The port officers stayed, and they worked 24 hours a day, 7 days a week since then. So we had to adjust the way we work, just like you all have. And knowing that staying home was not an option, this port's 24 hours a day, 7 days a week. It can't afford to shut down, as you can see from the previous slide. So we instituted social distancing and the use of protective equipment, as most people did. We suspended things like random vehicle searches, and we made checking of IDs a little more distant so that people weren't handling materials as much. I think in the very beginning, like all of you, nobody was really sure about how this virus spreads, and so we took extra precautions. We also spent a lot of time sanitizing our work vehicles, our workstations, our common areas, our checkpoints. They were thoroughly clean, and they are cleaned on a regular basis using commercial chemicals that are for that purpose. And, of course, our goal is to protect our employees and our tenants and our port users so we can all continue to have the port function despite the pandemic. Next slide, please. So as an organization, we continue to strive for best practices. And, again, you know, at the beginning of this thing, nobody really knew exactly what the best practices were. We all were just kind of working together with other government agencies to work that stuff out. We spent a lot of time working with other ports through our national associations. We used information, obviously, from CDC, Department of Health in the state of Florida, and the White House Task Force and others. We also contributed to a guide that was published by the American Association of Port Authorities. It talked about best practices for all types of operations, whether it was port employees in an office setting or dock workers out in the open. Next slide, please. So, as I said, we looked at things that other people were doing. Some other ports were actually taking on the responsibility of temperature screening. That may work in a port where there's one terminal and there's one set of rules. At our port, there are multiple terminals, and each terminal is operated by a different company on our property with their own fence lines and their own infrastructure and their own way of doing business. So the administration of testing by the Port Authority was one option that we decided not to engage in. Other ports did it, and they had mixed results, everything from really long traffic tie-ups to interference with their unions and things like that. So we just decided that really wasn't the way to go. And as I said, we tried to keep as many employees at home as possible to limit the opportunity for exposure among our workforce. Next slide, please. Mm-hmm. So on the places we had to keep open, we did what a lot of people are doing. And when I was going through these slides, I kind of was, a little hesitant because some of this stuff is just common practice now. But again, back then when we were all trying to pull this together in a couple of days and weeks that followed mid-March, we obviously were doing everything we could. So in areas that we absolutely had to have open to customers, we limited the amount of customers that were allowed in the facility. We created spacing using what a lot of people do now, which is markings on the floor. We also put an officer or guard outside to regulate the amount of people that could come into the facility at one time. So we were able to maintain our ability to issue visitor passes and permanent passes. That kept the business flowing. A lot of times the truckers that come in here they're not regular users. They're coming in with a one-time load with a bill of lading, and it's imperative that they're able to get in the port and get out. Of course, they're coming from other states. They're coming from other places that might have higher risk. So it was imperative that we segregate. We did the best we could to not expose our staff to those people that were coming from out of state, but still allow them to do their job. As I said, we're a 24/7 operation, so we don't really have the option of shutting down. That all the vital things that security does, including issuing credentials, continued. Next slide, please. So the Coast Guard came out. They're our prime regulator under federal law, and they've allowed for minor modifications in our procedures. And what that basically was not in the past. The officers had to actually accept credentials and take a look at them by physically holding them. The Coast Guard relaxed those standards to just let it be a flash pass, for lack of a better term, meaning the officer was able just to ask to see the ID while it was held by the ID owner, and they were allowed to pass with that. It's probably not the best rule, but it's a nice compromise to not have the officers continually touching other people's credentials. We also work with CBP, Customs and Border Protection. They board all the vessels that come into the port. By having to go on the vessel to conduct business, they were exposing themselves and also the crew of that vessel to people who were coming from foreign countries. Obviously, the crews, most of these crews are foreign crews that are coming here, and including China and Russia, which were high infection rate locations. And CBP also working here could have been infected and infected a crew. So we facilitated those inspections by putting tents up on the docks where they could bring the crew outside in the open air. They could do their inspections of the crew and their credentials and limit interaction. So, again, we work in the field. That's a good thing in a way. We don't have enough trucks for everybody to work to their own vehicle, but between the sanitation and being out in the open most of the day, I think it helped our security officers stay safe and healthy. Next slide. So one of the things Gary asked me to do was talk a little bit about the impact on crews, and we'll talk a little bit about the beginning, middle, and end of that. So you can see on your slide there's a number of different ships on there. Some of that is interesting because some of those ships are either for sale now or have been sold, and that's part of what the cruise business is doing to try to contend with this shutdown. So fiscal year 2019, which ended last year on September 30th, 2019, we had 1 million plus passengers. That was a record year. And for 2020, which is the year we're coming out of now, we were going to have Carnival, Holland America, Royal Caribbean, Norwegian Cruise Line, MSC, and Celebrity all joining us for this cruise season upcoming. And so MSC and Celebrity, those were going to be, and Holland America, those were going to be either returning after a break in service here, or they were going to be new cruise lines. And they basically just stopped any plans to come to any new ports and just maintain what they had. So that left us with Carnival, Royal Caribbean, and Norwegian Cruise Line after the virus broke out. Next slide, please. So as you all might remember, it was in the news a lot. This pandemic, when it in the area of cruise, started on the Diamond Princess. That was a cruise ship that was sailing in the Asian area, Japan. So that cruise ship left Yokohama on January 20th. On February 1st, after a visit to Hong Kong, one of the passengers tested positive for COVID. That ship was due to sail from Yokohama on February 3rd or 4th, but it was placed in quarantine. Those people basically became prisoners on that ship, not in the sense that they were being mistreated, but they had to stay in their rooms. They got all their food delivered at their door. They couldn't interact with the crew or other passengers while they were on there. What's interesting is at that point, again, very early in the pandemic, and probably not a good gauge of what was really going on, but the World Health Organization declared that ship accounted for 50% of the world's cases on cruise ships at that moment. So by February 24th, all passengers were able to disembark, and the U.S. citizens were able to return home. That left the crew. The crew was able to get off by the beginning of March, and out of that there were 12 deaths and 712 people tested positive. So again, it's unfortunately for cruising, you're in a very confined area, and it's very hard to despite diligence by the cruise lines, it's very hard to maintain clean areas when you have multiple people touching those areas at all times throughout the day and night. So the World Health Organization and CDC both expressed concerns about cruise travel that resulted from this incident on the Diamond Princess, and the cruise industry really became front and center of the impact of this as a symbolic of how this was really impacting the world with that ship over there. So the ship CDC issued a no-sail order on March 14th, 2020. I can tell you the cruise industry knew that was coming. They were actually preparing to shut themselves down, but I think it was kind of uneven about how they were going to do it. So the CDC stepped in, and they basically issued a no-sail order. So what that meant was prior to the shutdown, 40 ships had confirmed cases, and of those, 2,973 crew and or passengers were determined to have been affected on various cruise ships around the world, and a total of 34 deaths occurred on those ships. Repatriation of the crews took months. If you've ever been on a cruise, you know that there's the staff is made up of individuals with very, very diverse backgrounds from all over the world. They're from places like the Philippines and Indonesia. They're also from Eastern Europe. Some are from the United States, Canada. So trying to repatriate these crews became quite a task. We actually had cruise ships in our port for over a month that were basically just floating hotels for the crews while the cruise lines were trying to make efforts to get flights back to the home countries of these repatriated, to repatriate their crew members. So a typical ship medium-sized ship has about 700 or 800 crew. About 300 of those are required just to maintain the ship, meaning all the mechanical parts of it, the navigation. So while these crews were repatriated over months, a number of those crew members still stayed on these ships, and of course that created a great expense to the cruise lines because they were having to still staff these ships with no passengers and no cruises, and that put a great economic impact on them, which they're still feeling today. So the current no-sail order, when I made this slide last week, the current no-sail order was to expire today. CDC issued a new no-sail order through October 31st. That no-sail order also matches the industry's voluntary compliance of not sailing. So the industry had already announced they weren't going to sail in the United States before October 31st. So it'll be very interesting to see what happens then. CDC actually, this is in the press today, was requesting a no-sail through February, and they negotiated with the White House to make it the end of October 31st to see where we stood then. I will tell you that I have no inside information on this other than to say I'd be surprised if there's not another no-sail order. I really can't see a huge difference being made in the next month as far as cruise safety. Certainly we might be closer to a vaccine or have one that's out being tested on people like healthcare workers, but I don't see us sailing any cruise out of Tampa this year, meaning calendar year 2020. I could be wrong about that, but we don't have anything that's really firm right now. So in addition to all this, on July 21st, the CDC formally requested comments from the industry on the restart of cruise activities, and the responses were due by mid-September. They've all been submitted, and now CDC is reviewing the responses. There's about 7,000 responses from various groups, not only the cruise lines, but port operators and just individual citizens that have a comment on the cruise. What they're really trying to determine is, can the cruise lines really provide a safe, clean environment for people to cruise in during the pandemic based on what we know about the way the virus spreads, and that will remain to be seen. Next slide. So looking forward, there still are no standards, as I just said, for cruising in the United States. We don't have any standards for cruise terminals. We have an idea about what they might look like. To give you some insight on that, we feel that embarkation of cruise passengers onto a ship and the debarkation off the ship will take significantly longer when standards are instituted because of social distancing. I don't know for those of you that have ever been on a cruise, getting on and off those ships is a very tight schedule, and people get crowded very close together during both processes. So those are going to have to be spread out, not only for the safety of the passengers, but for people like Customs and Border Protection and the security officers that have to work in the cruise terminal around the debarking passengers. The cruise industry has also basically stated that at the beginning of cruising, they're going to want to do shorter cruises so keep the amount of time that people are on the ship, and they're going to go to their own private islands. Most of these big lines own their own private islands or terminals where they take people to, as opposed to taking them to somewhere like Cozumel, which is in a foreign country where people can walk around off of the island and go on tours and things like that. So that's probably what it's going to look like. Right now, that's what people are thinking. They're going to try. I feel the industry is going to do its best to try to, convince the public that this is a viable travel option. So the next question is, who's responsible for the screening? Well, first of all, we don't know what the screening is going to look like. I can tell you that what they've talked about is things like people proving they've had a vaccination, temperature screening, which we all know is not a perfect science when it comes to detecting the virus, and other options. again, this is going to add cost to the process, and it's going to slow down the process when they do this screening. So I know that they're struggling with coming up with something that is the most efficient, quickest way to get people on a ship or off a ship and still meet the expectation of the government entities involved. And of course, the state of Florida is not immune from that. There's a lot of politics in this. You have this desire for people to obviously be safe and not have their communities infected by returning cruise passengers. And that's certainly a huge responsibility of local and state government to assure that that's being done correctly, because they'll be the ones that have to deal with it if it's not. Then, of course, the federal government on a much higher level has to balance the need of the industry to survive and versus the protection of its passengers and the public that lives in these communities where these cruise ships embark and debark. And also have visits, like Key West is a great example. That's not a home port, but thousands of people go to Key West as a destination as part of a cruise out of Tampa. I don't know this for a fact, but I've been told that there may be a referendum in Key West to ban cruise ships stopping there, based on the fact that the city's worried about all that influx of people coming off those ships daily. Public perception obviously is a huge thing because these are optional things to do. The rest of the port doesn't, if we don't have an option there, if you stop the gasoline tankers from moving, nobody has gasoline. You can't live without gasoline. If we stop the freighters from coming in, a lot of the things you buy that are imported, including a lot of items from China, would just dry up on the shelves. So believe it or not, a lot of furniture is now made in China, and with everybody staying at home, things like Rooms to Go and those other companies are having a booming business of selling furniture, so that would dry up. And then building materials, which are still in demand in Florida, would dry up. So cruising is an option. It's not a requirement like a lot of other things. The industry has a lot of ships for sale. I think what you're going to see is that the industry is going to consolidate like the airline industry is. They're going to shrink the number of cruises and ships available to try to create a demand that meets what they need to make money on those voyages. So the average ship, and this isn't a hard and fast rule, but in general, a ship has to sail at about 90% passenger capacity to break even. They make their money off of onboard sales and sales of excursions, and that's how they actually make the profit. So the ticket you buy is generally just covering the ship and the crew and not really creating any profit for them. So the European model, does it work in the U.S.? Well, the current European model is 50% passenger load for the ship. Nobody has interior staterooms. They're all exterior rooms with things like balconies or windows. And they're not dining in communal dining. They're, as most people go on a ship, they enjoy the buffet. And, again, it's very crowded around the pools. It's crowded around other communal areas where people gather, the bars and things like the casinos. Again, those are all profit centers for these ships. So if you try the European model in the United States, 50% passengers, unless you increase the ticket significantly, may not cover the initial expense of the cruise. And then that onboard sales, which are vital to profit, go away if you don't have any communal activities on the ship. And next slide, please. So that's the end of the presentation. I don't know if you want to open the floor to questions. I'll be happy to answer them. And as Gary said, unfortunately, I have a hard stop at 10 o'clock. I know we won't go that long, but I was interested in hearing some of Gary's presentation before I hung up. So if anybody has any questions, I'd be happy to answer them.
Hey, Mark, it's Gary.
Go ahead, Gary.
First, probably just want to thank you for the presentation. And Also, Mark has been a member of our Preventative Radiological Committee for about, 10 years or so, I guess.
At least.
Yeah. So, and he's an active member, so thanks for that. Also, just wanted to mention, too, that he entertained me going around the port, I guess that's been close to 10 years ago, and assessing the vulnerability for illicit radiation being brought in. And subsequently, we've given him radiation detectors for his security team. Not sure how many you have, probably 5 to 10, something like that.
Actually, we're probably up around 19 or 20 of them.
Oh, wow. Okay. Also, Hillsborough Sheriff's Office has a on-site location and also performs radiological work there at the port. You want to add anything, Mark, to that?
Well, thanks for bringing that up, Gary. We're very active members in the Regional Domestic Security Task Force, which, of course, health is a major component of. I'm also the chair of the State Focus Group for Critical Infrastructure. So, again, can't say enough how much, when I was at FDLE and in my current position, we rely on health community, government health community for support, for education, and as a good partner. I think it's interesting that for years we talked about pandemics or intentional use of biological weapons as a possibility in our communities, and so we always had health involved, but I think people kind of didn't want to deal with that. So now I think it's served us well that we had committed to these communities of interest where we're all working together, law enforcement, critical infrastructure, fire, health, to when we get to a time like this, your organizations are not foreign to us. We have contacts, and if I don't know for sure who to call, I can always get a hold of Gary. He can point me in the right direction. As Gary said, there is a lot of radiological screening that goes on in the port. The federal government has a screening program. All inbound foreign containers have to be screened for radioactive material before they leave the terminal. We also randomly screen at the gates using screening devices. As Gary said, the Sheriff's Department has several CBRN capabilities right here located on the port with trained deputies. And and in our cruise terminals, the screening machines all have radioactive sources that have to be licensed and inspected on a regular basis. So there's a really tight multiple connections between you all, your counterparts, and the port.
Thanks, Mark. Also, should point out, too, that you posted, I don't know, probably 4 or 5 radiological exercises at the port, including on the Victory ship last November.
Yes, and of course, the National Guard was involved in that, along with our local responders, law enforcement, fire, the FBI. We're always happy to do that, and I'm sure we'll do another one next year somewhere on the port. We have lots of different venues we can do those in for, having sources found in different venues, like a cruise terminal or on a ship, and then having people work through that issue in confined quarters or in a public area that had a lot of people in.
All right. Well, thanks a lot, Mark, for presenting. We really appreciate it. And
thank you for the invitation.
Thanks. Hopefully now we can get you to see some of Gary's presentation.
Absolutely. I'm stand by to 10.
All right, Gary, can you see your presentation up on the screen?
I can. Looks good.
All right.
All right, want to go back just one?
Sorry.
There we go. Oh,
That's weird. Okay, well, we'll just look at this right now.
alrighty. Looks like we're ready. So as everyone can see, this is a multi-agency presentation. I've put together most of it, but there were other folks that assisted, including the FBI, All Children's, Tampa Police Department. Just briefly on my background, I retired last year after 33 years with the state, mostly with Department of Health. I gained my radiological knowledge from working as an inspection supervisor with the Bureau of Radiation Control, also at Florida State University and University of Kentucky in their radiation safety offices. And now I substitute teach primarily middle school science once in a while to keep busy as long as that works out. The virus doesn't help, but so far we're good. I still am currently on approximately 5 preparedness committees. Vice president of our FEHA organization. I co-chair the region for radiological detection. I'm also on the CHAMP, which is the Health and Medical Preparedness Committee for the county. I'm on the Local Emergency Planning Committee and also a member of the Urban Area Security Initiative. So with that said, we can take off. Next. So one of the first things that was funded after 9/11 was the MMRS, funded by Homeland Security. They created a radiation subcommittee. Of course, many agencies, hospitals were represented. And in Pinellas, we funded portal radiation monitors for the hospitals. Next. The hospitals were given a draft protocol. Myself provided radiological training to the hospitals along with their in-house radiation safety officers. And we had many meetings with various agencies to set up protocols, including hazmat, the county's medical director, etc. Next. There's a picture of one of the portal monitors under the exit sign. That is actually taken at the former All Children's Hospital. Next. And there's a close-up of the monitor. You can see it has a digital readout that's 1.4 microR per hour, which is a very low radiation rate. There's radiation around us all the time. Normal background radiation is anywhere from about 1 to 10 microR per hour. Next. These monitors can detect very small amounts of gamma radiation, and they're also calibrated not to go off for naturally occurring radioactive materials, and they have a backup battery in case of power failure. Next. Many of the plans for the hospitals are similar, some in-house differences. Their emergency departments are trained to respond, and normally they go off due to somebody just having a diagnostic or a therapeutic procedure. 911 call could be initiated if they would say that they have not had a scan, but yet they are emitting radiation for some reason. It could be an implant, but that's something that, of course, is allowed. Next. The consequences of having no monitors is you could have your hospital contaminated before it's realized that somebody was contaminated. Also then contamination to the staff and a long-term public perception. If we had one of our hospitals contaminated, you probably would see a decrease in the public attending that hospital, at least for a certain period of time, just like we were seeing with the problem with COVID. Next. And there's a picture of a contamination. Somebody has a Geiger counter. And you can see PPE is pretty normal. One thing that's many people ask me is why don't they have lead aprons on? And that's just because they're too heavy. They just couldn't operate very long with a lead apron on. Next. One of our first exercises then was in 2006, totally rad. There was an after-action report defining deficiencies. The workshop was held after that to try to address some of the deficiencies. I worked a lot on that exercise with Hunter Zeger. I don't think she's on the call, but she's still in emergency response with the Department of Health and is in many of the meetings that I'm attending as well. Next. And there's a picture. This is actually on the grounds near the, in Largo, near the education main building. And as you can see, it was pretty lifelike. Lots of folks involved, and they were moulaged. Next. So as I said, we had a multi-agency workshop after that in 2008. Next. We're at the Tampa Bay Regional Planning Council. We hold many meetings there, and I guess yours truly is leading the group. What I did was go through all the points of everything from the beginning to the end of the exercise, and with the various agencies, whether they were fire, law enforcement, Department of Health. I think I see Dan Simpson on the under the exit sign in the back white shirt, who has since retired. But it was a very good, well-attended event. Next. So our scenario was a dirty bomb at the Parkside Mall. Next. There we have the news, and as you can imagine, it would get quite a bit of press. So at that time, we didn't know whether the terrorism was involved or not, but as you can expect, it would have a pretty big impact on the community. Next. So we have hazmat on the scene, and the radioactive agent was defined as cesium-137, which is a common beta-gamma emitter, has a half-life of 30 years, and we use it quite a bit in our radiological exercises. Next. That isotope would probably be one of the top ones that would be used for a dirty bomb. Of course, long-term consequences, Department of Health would be definitely establishing a registry of carcinomas, leukemia, etc. Environmental contamination would be huge and costly to clean up and remove, etc. You'd have economic impacts of businesses relocating, and of course, it would affect tourism as well. Next. Fortunately, there haven't been a lot of radiation incidents. Radioactivity is very well regulated by the federal and state agencies. There was a few of note that were kind of interesting. One was in Guyana, Brazil. That was quite a while ago, 87. But just very briefly, a therapeutic facility shut down, but they forgot to remove the radiator with a radioactive source in it. Thieves broke in, thought that device may be of value, broke in and actually removed the radioactive source from the lead shielding. Consequently, we had 4 deaths. Thousands of people were had radioactive contamination as well as the surrounding community. Morton Plant Hospital was an interesting one in 2008. Radiation monitor alarms went off that I have described at Morton Plant Hospital. They didn't know why. Fortunately, they got a hold of the Department of Health, and our director called me. I still remember it vividly. She's now the assistant director of the health department. But I was actually just after work, and I still remember I was at Publix. So anyway, I got a hold of the hospital, found out that the person that was delivered and emitting the radiation had received a scan using I-131, which is a gamma emitter, consequently had a heart attack, couldn't speak, and so the result was resolved. Fortunately, I did calculations, and the medics that delivered the person received somewhat equivalent of a chest x-ray, which is a small amount of radiation. Hospitals, of course, respond to the alarms, but most all are adjudicated having radiological procedures. Next. Of course, preparedness continues. Unfortunately, MMRS funding was taken away by the Congress, but there are new streams of funding. Hazmat teams continue to receive new equipment, training, mostly through the Urban Area Security Initiative, of which I'm a part. And all of our 5 hazmat locations received new radioisotope identifiers. These cost close to $20,000 a piece. Next. The Florida. Yep. So in 2007, the DSOC created our Preventative Radiological Committee. There's 2 co-chairs, Department of Transportation and Department of Health. Of course, our primary mission is to prevent and interdict in any unauthorized radioactive materials. There's 7 areas that correspond to the RDSTF that Mark mentioned that he's a part of. Law enforcement, fire departments, Department of Health participate. And as I mentioned, I co-chair the Tampa Bay region along with a member of the bomb squad. Next. The equipment that we've received over the past 13 years or so, about 222 personal radiation detectors. These will detect radiation, but they won't tell you what the isotope is. But if it's a sizable amount of radiation, they will detect the radioactivity approximately a football field away. And their cost is approximately $2,000 a piece. We have 16 isotope identifiers throughout the region that were funded by UASI, the Urban Area Security Initiative, not including other RIIDs that have been purchased through local funding, particularly for our hazmat teams. The Fish and Wildlife Commission is on our committee, and they have 3 backpacks that are primarily utilized at large public events like football games, Gasparilla, etc. We also have 2 mobile systems. These were obtained through the UASI grants as well. They were approximately $70,000. They're run off of laptop computers, and their detection system is encased in a container that's approximately the size of a small casket, to put it bluntly. An interesting side note on those, when we had our Republican National Convention in Tampa, I was obviously working with the Department of Health then, and I was elected or selected to monitor all the delegate hotels and transportation routes from Tampa to the St. Petersburg area. So for the week, I had the system in my car, the laptop on the passenger seat, which has a nice visible screen with graphics that tell you not only the radiation rate, but what isotope it is. I had the detection system in my trunk, and it was quite interesting pulling into places like the Hilton or Don Cesar and said, here I am. And fortunately, only one facility really questioned my authority. So fortunately, there were no hits except for naturally occurring radioactive material. Training continues. Much of the training at the very beginning was put on by the Indian River State College, but since we have formed our own training committee, which myself and a member of the Bureau of Radiation Control lead, and we have about 5 other folks on the committee, primarily from that are Homeland Security sheriffs in the area. And we did have an advanced radiological class provided by the Homeland Security, DNDO, in 2013. Next. The tabletop exercise was in 2013. There were various events and so forth. Again, as usual, we had after-action reports. Changes were made to our standard operating procedures, etc. And the training needs were identified in the advanced radiological class. Next. It was a 3-day class in 2013. We had quite a few participants. They were trained on all the different radiological equipment and area sweeps, choke points, etc. And we did have a special event using the incident command system. Next. So we did have a operation that was called ROPE, a full-scale exercise in 2014. There was training provided. In fact, our new mobile system had just arrived. And then the Homeland Security DNDO exercise team participated in our full-scale exercise at the Port of Tampa. Next. And there's a map of the Port of Tampa. On your right-hand side is where the port is, and Fantasy Island is designated, and that's actually where the radioactive material was being brought in by the terrorists. Next. And that's a list of the participants in the exercise, local, state, and federal. And as you can see, it was well attended. Next. There's the command vehicle that was utilized during the exercise. The person in the foreground with the tan shirt is the captain with the Fish and Wildlife Commission that's on our committee, Roger Young, and also Mark Dubina that just provided the other presentation is there in the white shirt near the entrance to the vehicle. Next. There's a gathering in front of the Terminal 3 before the exercise. I provided the radiological scenario, and there were probably approximately 50 players. Next. We're looking out towards the west, and that is Fantasy Island off in the distance. Next. And there's one of the robots used by the bomb squad searching for the radioactive material inside the terminal. Next. There's 2 officers that are looking at the radiation device. That's a RIID with the blue cap. The blue cap designates that it has neutron detection capability, and the gentleman holding, or not holding it, it's hard to tell who's holding it, but anyway, the gentleman in the foreground is with Hillsborough Sheriff's Office Bomb Squad, and the other person is Steve from the FBI. Next. There they are again looking at the display. Next. There's a total containment vessel that they can utilize if there is a some type of explosive device, so that obviously the public is kept safe from it. An interesting side note, during the exercise right along where that vehicle is now in front of the terminal, there was a backpack that was not attended, and so the exercise had to actually be stopped to have the backpack checked to make sure there were no problems, illicit materials, etc. in it. Next.
Hey Gary, can you explain what that machine is on the back of that truck?
Oh, okay. It's just a containment vessel that's steel and lead lined to contain any type of explosive device. And there's one of the Hillsborough sheriffs in a small vehicle, and actually the white box that you see is one of our 2 mobile systems, and the you see a cable going up front that will be connected to a laptop that runs the radiation device, as well as allows you to see what radioactive materials are present and what their radiation rates are. Next. So another exercise that was held in 2016 was at Tropicana Field, nicknamed Raise Up. Scenario was that a small plane is going to crash into the roof, carrying radioactive material. The crowd is evacuated. Fortunately, no injuries are reported due to the plane landing on the field. And EMS and hazmat responds. Radiation detectors go out, and of course, then many agencies are called in. Next. Different players are triaged. Radiation surveys begin on primarily the players that were on the field in the crash site. Isotope is determined to be cesium-137. Fortunately, it's a contained radioisotope, double encapsulated in steel, and so there's no radioactive contamination, just the radiation capsule. Some players were sent to local hospitals just to practice for the event. No decontamination, though, as I mentioned, was needed. And the FBI was there, and they started their investigation to determine whether the crash was deliberate or not. Next. And as you can see, they actually brought in a small 1-engine plane that was placed on the ball field. Next. And there you can see various hazmat, law enforcement, and other officials during the event on the field. They actually brought in a high school baseball team to simulate the players actually being on the field. At that point, they had been removed. Next. Here's one of the RIID's radioisotope identifiers. That is the Ortec version, and that is the Cadillac of all RIIDs. That cost approximately $100,000. It has a high purity germanium detector, which is very expensive, but is very good at detecting and identifying the radioisotope. The FBI has some of these, and the Bureau of Radiation Control, I believe, has two, and actually our National Guard Civil Support Team here in Pinellas has two of them. Next. In 2019, the Port of Tampa again hosted a radiological exercise. The scenario was that the FBI receives intelligence that sources have entered the port in containers. And we used two sites. Terminal 3 again was closed down and used for the event, as well as the Victory ship, which is docked right next to the terminal. The Victory ship can be toured by visitors. We placed various sources at both sites, and we had numerous federal, state, and local agencies participating. Next. Some sources were identified. There were a couple that weren't identified due to masking. This is when you have one source that is very strong, that is over masking another source that is hidden, which is something that terrorists would probably do. In review and the hot wash, the strengths were cooperation in the agencies. Weaknesses were we had several officers that were weak in their knowledge of equipment and health physics, but those have been addressed since. Next. At the exercise, after the event was over, we had a vendor that showed how a drone could be used to localize, find the radiation source. There's a small radiation detector that's actually attached to that drone. Next. There's Terminal 3, where the actual sources were placed, as well as in the basement of that building. And that's where you do actually board if you're going on a cruise. Of course, it was empty except for our teams. Obviously, no cruise attendees. Next. And there is the Victory ship that's there docked now for primarily tourism. And it was actually used in World War II. Very interesting to have. We placed radiation sources in the galley and in actually what used to be a walk-in cooler. Next. There's a picture of several of the officers looking for the radiation sources. That doorway that's just to the left of the TV screen is actually where the walk-in coolers were and where two radioactive sources were placed. You could detect the sources from that walkway, but of course they had to go inside to identify what the actual isotope was of the source inside. Next. And our PRND, our committee today, as I mentioned before, the training team was formed, and we've trained over 100 officers now in the 7-county region, and we provide classes as needed and refreshers to the region at no charge. Next. And of course, radiological preparedness continues. Matter of fact, tomorrow we're having a radiation exercise in Tampa that's being hosted by the National Guard's CST, and the CST is their specialized team for WMD events. It will be primarily radiological, and there's actually going to be 2 more exercises this month, and I've been asked to be the incident commander for the exercise tomorrow. So we're in last minute preparations for that event. Thanks, and hopefully questions have been answered.
With that, I want to thank everybody for attending our coffee hour with FEHA. It's now 10 o'clock. I'll let you guys all get started on your day. All right, well, stay tuned for some more webinars coming through from FEHA. We're going to have some more district meetings coming the rest of this year. We're shooting for at least 1 a month for the rest of the year. We're going to be having some in-person meetings as well. We're going to be having some outings in the Tampa Bay District. We're talking about some canoe trips and some hiking trips, and we're going to get outside and we're going to do some good outside while we can and while the weather's getting nice. So I want to thank everybody for coming. And if you have any questions, just let us know. I'll be looking for your emails to get your certificates. And I hope to see all of you at our next FEHA district meetings. So thank you and enjoy your day.